So looking at some of the physiological effects of heat application. So an increased circulation will occur, and they say up to 1.5 to 2 times the normal resting blood flow. You get an increased metabolism, again, which would make sense if you're heating the area and increasing the temperature. Increased inflammation. So again, this is something to consider when you look at how deep of an area you're treating and whether you're still kind of in an acute stage. So there's benefit to this from the standpoint of you will get, if applied at the right time, the increased phagocytosis and wound healing, which at certain times in the healing process, that is obviously a benefit to help in promoting that. Some of the other physiological effects, the decreased pain and analgesia, and it's believed that comes about through a sedative effect. So it's a more relaxation type of pain control. We believe that it helps in driving the gait. So again, if you have started looking at the pain control discussion, we're looking at like a level 1 pain control here, but it's primarily just for more soreness, aching type of pain, not so much for acute pain. So the more acute type pain, it's believed that heat isn't quite as effective for that. So we'd be looking at different modalities in a situation where there's more of an acute type pain versus more of a chronic persistent type of pain situation. Some of the other effects you get, again, because of the relaxation effect, you get some decreased muscle spasm and a decrease in tissue stiffness. A lot of the decrease in tissue stiffness is going to come about through a decrease in the viscosity of the tissue. So the fluid viscosity will decrease because of the increase in temperature to the body part. So another thing in looking at how the body kind of responds to having a heat modality applied to it is the concept of heat sinks. So when the temperature of an area gets increased because you're applying a heat modality to it, the circulation obviously looks to kind of carry it away and dissipate it. So the larger the heat modality, you have to consider how long and what the actual temperature of the modality is going to be. So for instance, a good way to see this is with a whirlpool. So if you have a warm whirlpool, the larger the body part or more of the body that's actually in the whirlpool, the lower the temperature has to be because the body can't dissipate the heat quite as readily because more of the body is going to be covered up. So for instance, if you look at maybe just placing the ankle and lower leg in the whirlpool versus a total body warm whirlpool, the total body warm whirlpool will be kept at a lower temperature because the body really can't dissipate the heat quite as readily. If you think about doing a full body warm whirlpool, most of your body's in the whirlpool, therefore you don't have as many areas of the body to dissipate the heat, and the temperature will increase a lot more, versus if you only have a limb in the whirlpool, obviously the whole rest of the body can help in dissipating the heat that builds up. So essentially, the more, in a situation like that with the whirlpool, the more of the body, the greater the body surface area, better way of putting it, is in the whirlpool, the lower the temperature is going to be. And we'll talk about what are some temperature ranges for the body in that type of situation. So some of the short-term changes that will occur with local heat application, again, the thing you have to remember is with the modalities that we're focusing on and talking about right now, all of these effects are mainly going to occur at a depth of 1 centimeter. You will get some of them deeper, but the temperature increase isn't going to be enough to create a significant therapeutic effect. So now, granted, there are body part regions that will have a greater response to this just by the nature of the superficial anatomy, but that's primarily where you're getting these effects. So an increased local temperature, increased metabolism, an increase in vessel size, so again you'll get the vasodilation that occurs, and the increased blood flow and increased nutrition. Again, not a whole lot will happen with the application of superficial heat, but again, if you're treating a more superficial area, you may get a better effect with that. Again, it's encouraged that obviously exercise is truly the best promoter of all of these things at a depth and level that will create these responses in a much greater fashion. Again, some of the other short-term effects. So increases in phagocytosis, capillary permeability, increase in the axon reflex, which will increase histamine production, increase in cell pressure, and increase in joint temperature. Again, the questions here are, again, all in as it relates to how deep is the area that you're treating. So some of these effects are a little more questionable as it directly relates to some of the individual areas we'd be treating. And again, just to show an example. So again, if you were treating like a finger per se, okay, most individuals, obviously the fingers, the PIP joint in the finger is very superficial. So you're probably going to get, you're essentially going to get all of these areas, all of these things to occur in a superficial area such as that, versus again applying a superficial heat modality to, say, the quadricep. So the quadricep is a very large area. You're not going to get all of these effects to the same level as you would in an area like the hand in most people. So again, they are all effects. The questions that, as it's kind of shown here, is how much are they going to occur in the area, and again, that'll be dictated by the depth of the structure that you're really trying to get at. Again, the primary thing, particularly as it relates to the larger body part areas you're really looking to get, is just some of the general sedative effects and the pain relief mechanism that occurs through the gate control.